back to the Advanced Functional Medicine blog. Before we get started on the discussion on vitamin D, I just want to thank everyone for visiting the blog and leaving comments. I'm having hundreds of hits a day on these concepts, and a lot of these people who are viewing have also become patients through our telehealth online services, where we do online video consultations and treatment. So the no distance is too far. So I just want to thank everybody for visiting. So we want to get into the vitamin D issues today. There was a new study that just came out from Johns Hopkins. They showed, from this study, they showed an increase, a 26% increase of dying from any cause by low levels of vitamin D. Now, vitamin D are typically found in fish. Tuna, cod, mackerel tend to have the highest levels. However, a lot of the fish these days are very depleted in vitamin D because a lot of them are farm raised. And that covers just about the majority of the fish that we consume in the United States. On top of that, we're very obsessed with the use of sunscreen, which blocks out both UVA and UVB rays. UVB rays stimulating the body's ability to produce vitamin D. So you're not getting burned, but you're also not getting the vitamin D that you need. There's other ways of doing that, but that's outside of the scope of this video. I'll do another blog on a good way to make your own sunscreen. So vitamin D has also been shown in the same study to show an 80% increase of what's called small vessel disease in cardiac tissue and vessels. That's huge. That's huge. And so some other things that has been shown, low vitamin D levels, is something like deep pain in fibromyalgic patients. A global pain that feels like a deep bone type pain has been associated with low vitamin D levels. Also, immune imbalances, inflammatory processes such in the lungs, such as asthma, has been shown to greatly improve with higher levels of vitamin D because of the way that vitamin D balances out the inflammatory responses. Low vitamin D levels has also been shown in other studies to increase the risk of breast cancer. This is also because of how it affects the immune system, and cancer is a breakdown of the immune system. So you say, okay, well, if we're out in the sun, we should be getting the right amount of vitamin D. Well, we're not. And vitamin D can be tested. I test it in every single one of my patients because it's that important. And let me blow you away here, is that I've probably ran over 100 vitamin D tests. And let me tell you, I've only had one patient out of all those tests ever come back in the normal ranges, or even close to optimal range of vitamin D. That's huge. The majority of everyone I test ends up being extremely deficient, and people don't know it. So what can be done is that you need to find a functional medicine practitioner. We're available to help. We just opened our telehealth service in which we can help people across the United States and Canada via online and video conferencing. But to monitor those vitamin D levels and to supplement with good sources of vitamin D, and to try to find good sources in the diet, but also, if you are extremely deficient, to supplement until those levels are where they need to be. And so it's an extremely, extremely important thing to do, because low vitamin D levels are extremely dangerous. But not just low vitamin D. We test everyone for vitamin D here, but that is included in the comprehensive care that we give to these patients. We don't just stop at vitamin D. We use laboratory tests, blood tests, saliva tests, stool tests to understand the function of each individual patient. So we test the vitamin D. We also test vitamin A, E, all the minerals, all the amino acids, neurotransmitter breakdown for mental health. It's very important that that the care is given at a comprehensive level. So it's not just vitamin D, even though it has been linked to so many things. So please be kind. Leave some comments here on what you thought about the video, and please, I'm open to questions. Please email your questions to dr.b@truehealthdc.com. It's on my website. Please allow several days for me to answer. I get a lot of emails and I'm very busy, but I will get back to you. So I appreciate it. My name is Dr. Brady Hurst, and thank you for watching the blog. Again, if you have any questions, contact me. We'll see you next time. Bye-bye.